cognitive behavioral therapy for insomnia is the recommended treatment for insomnia, all-comer insomnia, as well as insomnia in patients with neurologic disorders. But the way that cognitive behavioral therapy for insomnia is traditionally done is one-on-one with a psychologist. It's very labor intensive. You have to do it for 6 visits. It was always done in person before the pandemic. There was research on doing it over Zoom. Actually, that research was being published before the pandemic. But then, of course, once the pandemic happened, we all pivoted to Zoom and we all did the work over Zoom. And we're like, wow, this works just as well. And people are more willing. So regardless if it's on Zoom or one-on-one, it's labor intensive to do it that way. There's not very many people who are trained to do cognitive behavioral therapy for insomnia in the country. And if you take the number of people with insomnia times the number, it's, hundreds of thousands of patients, right, per provider. We don't have the capacity. So the president of the American Academy of Sleep Medicine this year is a fabulous psychologist, Jennifer Martin, and it's been part of her push is to try to increase access to cognitive behavioral therapy for insomnia. So she had a summit on this with a bunch of providers, problem solving this. She's had a reimbursement task force, which I was on, trying to figure out how to increase reimbursement. It's a big push for all of us to try to increase access. And one of the great developments has now been apps that will do CBT-I. This has also been coming a long time. This research at this point is probably 10 years old, 10 or even 15 years when these first apps were developed, but there's more and more of them. They're getting better and better, and we're getting more research. And the research is really reassuring that using an app-based insomnia program, if it's a good app, does seem to be really beneficial. And we're sorting out now who can start with an app. Can everybody start with an app? Should some people start with one-on-one? But the goal is that most people with insomnia can do an app-based CBT-I, and then it will reduce the number of people who actually need to see these specialized behavioral sleep medicine providers. And when I was preparing the talk, there were really cool studies on using app-based CBT-I for people with neurologic disorders, with the most interesting one being in people with mild cognitive impairment, that they had them do mild cognitive impairment plus sleep difficulties. They had them do app-based CBT-I, and they've got cognitive impairment, right? Mild cognitive impairment, but they were able to do it, and they showed that the sleep improved. And in the more classic CBT-I studies in neurologic disorders, it's not just the sleep that improves, the neurologic disorder itself will also show improvement, including improved cognitive outcomes, amazingly, in patients with dementia who do CBT-I. This has been shown in a couple studies. So I think that's really cool. And one thing I said in the talk, which I encourage, is if you have a patient with migraine and sleep problems, we're always taught in medical school or, in your training, think nortriptyline, right? A sedating migraine prophylactic medication. But actually, you should be thinking cognitive behavioral therapy for insomnia. And even in an app, just have them do that. And in all likelihood, in addition to the sleep improving, the headache frequency is going to improve. And I've seen that in my practice. So it's a really great thing. And my talk slides, which you can access online, there is a list of cognitive behavioral therapy for insomnia apps that are currently available, as well as links to the databases where you can find an actual provider, behavioral sleep medicine trained provider. I would like there to be official recommendations by the American Academy of Sleep Medicine and the Society for Behavioral Sleep Medicine. I think it's hard from an organization standpoint to endorse a specific product that somebody's making money from. I think these things are touchy, and I think the reason we don't have that guidance now is because it's what's allowed, sort of how can we be neutral, but still enable access to this. So I think the people in charge, I am not in charge of these organizations by any means, and the people who are in charge, who are far smarter than I am, are trying to kind of figure out what we can actually say. But I'm hoping that in the future, there will be guidance where there's an actual link on the American Academy of Sleep Medicine website that says, here's the list of apps. Maybe they're agnostic about which one to choose, but give some kind of information. And maybe we can cross-post that on the American Academy of Neurology website, the AAM, all AMA, and all these other organizations, so that people can have easy access to it.